Today marks 3 months since Rhode Island confirmed its first case of COVID-19. I'm Shannon Heggie.
And I'm Mike Montecalvo. Hundreds of deaths and thousands of cases later, the state is moving along the road to reopening. The Rhode Island Department of Health reports another 2 Rhode Islanders have died, bringing the state's death toll to 720. But the daily number of positive cases and those in the hospital continue to decline.
With Rhode Island now in phase 2 of reopening, Governor Raimondo says it's still crucial for people to stick to social distancing and mask wearing. Eyewitness News reporter Ted Nesi joins us live from the State House. Ted?
Shannon, Mike, gyms, indoor restaurants, hair salons, all allowed to reopen today in phase 2 with restrictions, and the maximum size of allowed social gatherings is now up to 15 people. Rhode Island enters phase 2 of reopening with good news on coronavirus trends in the state.
We're able to do this because our COVID-19 numbers have been stable.
The Department of Health reporting just 195 COVID-19 patients in the state's hospitals, down by nearly half compared to just over a month ago. And out of thousands of tests done over the weekend, only a small percentage came back positive.
We are moving in the right direction, and this is largely because of your patience, your cooperation, your decisions to prioritize health and well-being for yourself and your fellow Rhode Islanders.
Governor Gina Raimondo says the numbers reinforce her commitment to lifting restrictions, adding that officials spotted only a few isolated problems over this past weekend.
In Lincoln Woods and Colt State Park, we have to do a better job. We had to break up too many large congregations. We don't want another outbreak. We're entering phase 2 now. I'd like to be able to enter phase 3 in July or end of June. It means we have to follow the rules now.
With a significant number of establishments allowed to reopen Monday as part of phase 2, the governor expressed concern that only 70% of businesses have filled out COVID control plans that the state is requiring.
70% is not okay. 100% of businesses that are open need to have a COVID control plan.
She urged business leaders to download a control plan template from reopeningri.com if they haven't done so yet. And despite the improvements statewide, there is still concern among officials about some individual communities. In Providence and Central Falls, 1 in 4 residents who've gone for a COVID-19 test has tested positive. Live at the State House, Ted Nesi, Eyewitness News.
First tonight, a major step on Rhode Island's road to reopening.
Phase 2 is officially underway, allowing many businesses to welcome back customers, but there's still plenty of concerns about the virus and its impacts.
Eyewitness News politics editor Ted Nesi joins us live now from the State House. Ted?
Shannon, Mike, every day we hear from viewers who have specific coronavirus concerns. An example was over this weekend. I got an email from a woman in Warwick who said she hasn't left her apartment in her assisted living facility since March 11th. And she said she's frustrated that the state isn't distinguishing between nursing homes and assisted living facilities. So I asked about that at today's briefing. Is there any thought to, I guess, distinguishing at some point between the assisted living setting and the nursing home setting?
Yeah, we have been talking about this, and I'm going to let the doctor handle it.
We've recognized and understood the challenge, have felt the challenge of people not having the access to visitors or being able to get around to the extent that they would like to. What we want to do, particularly during this phase, is really be able to work in a more tailored way with facilities going forward to put together a plan, because individual facilities, nursing homes versus assisted living, will have different levels of capacity, different numbers of people to respond. So through phase 2, we want to keep it the way it is in terms of no visitation, but want to actively work towards what type of approach would work best.
And the health department data does bear out the difference between the two kinds of facilities. As of last week, there had been over 2,400 coronavirus cases in Rhode Island nursing homes, compared with only about 150 at assisted living facilities. Live at the State House, Ted Nesi, Eyewitness News.